Okay, so here's a CT scan that seems like it was a bit cut off in the anterior. And even though the automatic model alignment to the CT scan and blue sky plan is actually quite very good, in this situation it didn't do a perfect stitch, but we were able to use one of our other techniques, a point technique, to be able to do the stitch. And here we could see the results are very good. And if we take a look at that as well in our other views, we could see that the outline of the model is very tightly wound around the CT scan, which means it's an indication of a quality merge. And we could see that in other views as well. We could see the green outline around the CT scan as we move around the arch. So let's just take a look at that technique so that users could take advantage of it in situations where the automatic alignment, for whatever reason, isn't spot on, didn't work properly. You could go ahead and align the models very easily using a different technique. So here we see we're going to start the process. We're going to go to implant planning and surgical guide, select the option for surgical plan with CT and optical scan, which is what we're dealing with. And if this was for a real patient, then I could choose existing patient, choose a patient from the list, or a new patient and create a new patient. But since this is a demonstration video, I'm just going to click skip patient, not associate the case with a particular patient right now. This is for an upper arch, so I'll select that and then go ahead and click on next. Okay, locating the CT scan, I'll select the folder that contains the CT scan and click OK. Here, the field of view, we can see right here actually that the anterior is cut off in the field of view. I'll go ahead and click on OK. And here also in our 3D, we can see there's a lot of scatter, and we could see how the anterior of the CT scan is missing some data. Anyway, let's go ahead and select our optical scan. Click OK. Here we can see our model. Everything's good. Upper jaw. If we selected the wrong jaw accidentally in the previous step, we could just go back, select the correct jaw, then move forward again. The data will still be here, and then we could proceed. Anyway, let's click next and proceed. So the data is being pulled into the software. The automatic model to CT alignment is running automatically. Okay, we're not importing any additional surfaces right now, so I'll close this. And we could see here that the alignment is not that great. And if we look at it in our 2D views as well, we could see clearly that the outline does not wrap around the CT teeth and the alignment is off. So what we're going to do is we're going to switch over to our model manipulation panel. Here we have our model, our jaw, and we have different alignment techniques. So we have, if we could expand it, we have our automatic, we have an option of aligning it to two teeth. But because there's a lot of scatter in this case, and because we're actually missing data, I'm going to choose points. Before I do that, I'm going to raise the density threshold slider that we have here on the bottom, so that when we're placing the points on the CT scan, we're going to have less scatter in the view, and we'll be able to place those points more accurately. What we could have done as well is in the field of view step at the beginning during the import, we could have removed some of the lower arch as well to clean it. If we go back to model manipulation, choose points, and what we see on the screen right now is that we have our CT scan showing up on the left side of the screen, and we have our model showing up on the right side of the screen. And what we're going to do is simply identify a few points that we could see in both of the scans. Okay, so let's mark some of the points. It doesn't matter whether you do it, if you do 5 points on one side and 5 points on the other, or if you do 1 and 1. But what's important is you kind of want to disperse those points throughout the arch and mark clearly identifiable points in both of the scans. So to rotate, I'm just using my left mouse button to grab and drag. When I want to mark a particular location, then I hold down the Shift key and the left click and try to get those as accurate as possible. Let's go over to the other side of the arch. Okay, let's mark a few points here. And as I mentioned earlier, you just want to spread them out and try to choose those points as accurately as possible. Once you have that, just click OK. And now we can see the results on screen. We could see in our 3D view, we could see in our axial view, as we get closer and closer to the occlusion, it wraps tighter and tighter around the teeth, which is a very good sign. And our cross-section slices as well, we could go around the arch, and we could see that the outline of the model around the areas of the teeth is wrapped tightly around, and we have a good stitch.